Hi guys, so in this video we'll be talking about the medication Digoxin. For those of you watching on Instagram, you'll have to head over to YouTube for the full video, and for those of you watching on YouTube, you can also check out my Instagram MD in the making. So we'll be talking about the medication Digoxin. One of its use is in heart failure. Now this is the problem with heart failure. The heart has difficulties contracting, and if the heart cannot contract as it should be doing, then there are difficulties getting blood out of the heart, so we have less blood circulating around the body, so we need some help. So we use the digoxin is used to increase the contractility of the heart, so more blood can leave the heart and get around the body. And how does it do that? We're going to talk about the in-depth mechanism, but let's just give you a quick rundown. So what it aims to do is to increase calcium inside the cardiac myocytes. Cardiac myocytes basically mean cardiac muscle cells. So the more calcium that is inside the cardiac muscle cell, the more contractility we can have. So let's now get into the nitty-gritty of it. So to start, we're going to look at the regular mechanism of the body. What takes place before you give the drug, or what takes place on a regular basis. So you can see the cell, right? And inside the cell, you have these ions, sodium, potassium, calcium. There are more ions, but for the sake of this video, those are the ones that we'll be looking at. So those are the ones inside the cell, and intracellular means inside the cell. And then we have ions outside the cell, sodium, calcium, and potassium. Outside the cell is the same thing as saying extracellular. So let's look at what happened. If you notice, there are two pumps. We have the sodium potassium pump, and we have the sodium. Oh, there's an A missing. Let me add it quickly. And then we have the sodium calcium pump. So let's start with the first pump. So the sodium potassium pump that you see here, it uses it's basically active transport, meaning that it has to use this thing right here that we call ATP. ATP is referred to as the energy currency of the cell. Just like you would go to the supermarket, you have to use money to get the groceries. So this pump to function, we need ATP. So look at what happens now. This sodium potassium pump is going to take 3 sodium outside of the cell. So it's going to take 1, 2, 3 sodium outside of the cell, and it's going to put 2 potassium inside the cell. And in order for it to do that, it has to use ATP. And then we have this next pump, the sodium calcium pump. The sodium calcium pump. And let's talk about how this one works. This one is passive transport. It's not active. When I say passive, it means that it does not need ATP like the previous pump. And it's also important to know that the sodium potassium pump is also referred to as the sodium potassium ATPs. So you understand how this first pump works. Let's talk about how the second pump works. So remember that this sodium potassium pump is taking 3 sodium outside of the cell. And since it's taking 3 sodium outside of the cell, we're going to have a high amount of sodium outside of the cell. And it's going to create this sort of current now. Imagine that a lot of sodium is creating this sort of current. And this sodium current, due to the high sodium outside the cell, is going to trigger this pump, the sodium calcium pump. It's going to trigger this pump to pump 3 sodium into the cell and 1 calcium outside of the cell. And I'll just go over it back again. So remember, we have the sodium potassium pump taking 3 sodium out and pumping 2 potassium in. And since it's taking 3 sodium out, there's going to be a high concentration of sodium outside the cell, and that high concentration of sodium is going to create this kind of current that is going to trigger this sodium calcium pump to put back the sodium, 3 sodium back into the cell, and to take 1 calcium out. I hope everyone got that so far, right? So now imagine that as I said before, we need calcium inside the cell for contractility. So the more calcium inside the cell, the more contractility we are going to have. So remember that this pump, this sodium calcium pump, was taking 1 calcium out. So if we want to increase contractility, we have to stop this pump so the calcium can stay inside the cell and not get outside of the cell. So what are we going to do? In order to stop this pump, we have to stop the sodium potassium pump. Because remember that it was the sodium current created by this pump, that high sodium outside of the cell, that was causing the current because of the sodium potassium pump that was triggering the sodium calcium pump to pump the calcium out. So what we are going to do in order to stop the sodium calcium pump, we are going to block the sodium potassium pump. And that is what digoxin does. So digoxin blocks this pump. Let me see if I can get a marker. To draw X. You can't really see the X, but that's what digoxin does. So we're going to block this pump, the sodium potassium pump. So imagine that this pump is blocked. That means that we cannot get the 3 sodium out and we cannot put 2 potassium in. So if we cannot get the 3 sodium out, what does that mean? That means that the sodium is building up inside of the cell, and we don't have that current anymore outside. So the sodium is building up inside the cell because we cannot get the sodium out. And since we cannot get the sodium out, we don't have that high sodium outside the cell creating that current that will trigger this pump to take the calcium out. So we don't have the sodium to trigger the sodium calcium pump to trigger the to cause the calcium to leave the cell. So in that case, we have more calcium inside the cell, and more calcium inside the cell means more increased contractility. And I hope this was helpful, and if you want to see more videos like these, then subscribe, like, comment, and see you in the next video. And that is how the drug digoxin does its action in the case of heart failure.